As coronavirus cases keep soaring throughout the state, hospitals are filling up their ICU beds to treat those infected. But what does that mean for rural hospitals who don't have the space or the equipment to treat their COVID patients? Our Stephanie Poole talked with the medical center about their treatment process. She joins us in the studio with that story. Stephanie.
That's right, Andrea. When it comes to treating COVID patients, having the best form of care is vital. Now, that's the route rural medical centers are taking, even if it means transferring patients to other facilities.
I think everybody in the healthcare industry, if you wanted to say, was on pins and needles. I think we all are, because there is just such an uncertainty, and because of the surge in cases that we've had statewide.
Winston Medical Center is one of the few hospitals without an ICU facility. Hospital CEO Paul Black says to treat severely ill COVID patients, they're relying on other medical facilities to house them.
We go anywhere from UMMC in Jackson all the way to North Mississippi in Tupelo, OCH, Golden Triangle in Columbus, down to Rush and Anderson in Meridian. Whenever there's a patient that is deemed to need an ICU service, we'll look out to those particular areas and try and find a bed.
Around 35 to 40 patients are transferred each month, most cases right from the ER. Even though Winston Medical has the personnel for care, some patients might require special attention.
We've got staff, and we've got physicians that can handle COVID positive patients. But if you have a patient who has comorbid conditions and they start going real bad and they've got complications, then there's a determination that says that this patient needs to be in a higher level of care.
To lower the curve, Black is urging everyone to practice safety measures like wearing a mask and washing your hands regularly.
That's a concern. That's why we're getting into an emergency situation with ICU beds, is that you've got normal stuff going on, then you got the COVID taking place, so when another normal comes in, it creates a problem.
Black is monitoring daily updates from State Medical Officer Dr. Thomas Dobbs. He says the hospital will continue to use this practice until further notice.